Introduction. Depression. Depression is a serious mental health disorder that affects millions of individuals worldwide. It can manifest in various ways and impact people's emotional, psychological, and physical well-being. While it is common to feel sad or down from time to time, depression is much more than just occasional disorder or sadness. It is a chronic condition that requires attention, understanding, and treatment. In this article, we will explore the different aspects of depression, including its symptoms, causes, types, and the available treatment options, along with strategies to manage the condition effectively. Number 1. What is depression? Depression often refers to as major depressive disorder. It is a medical condition that negatively affects a person's mood, thoughts, behavior, and overall health. It is categorized by presence, feelings of sadness, hopelessness, and lack of interest in daily activities. Unlike typical feelings of sadness, depression lasts for an extended period and often interferes with one's ability to function in daily life. Persistent symptoms. Depression usually has its own effects. It is marked by symptoms that last for at least 2 weeks and can continue for months or even years if left untreated. Beyond sadness, depression is more than just feeling sad. It includes feelings of worthlessness, loss of interest, and a general disinterest in activities that once brought joy. Chronic condition. It is a long-term condition, and while symptoms can improve over time with treatment, it is common for depression to return. Understanding depression is essential in providing support to those who experience it and for seeking effective treatment options. Number 2. Common symptoms of depression. Depression manifests in various symptoms, which can differ from person to person. However, there are certain key signs that are commonly observed in individuals suffering from depression. Emotional symptoms. The emotional signs of depression include feelings of sadness, hopelessness, and irritability. Individuals may also experience guilt, worthlessness, or a sense of helplessness. Behavioral symptoms. People with depression often withdraw from social interactions and may lose interest in activities they once enjoyed. They may struggle with making decisions and experience a lack of motivation to complete daily tasks. Physical symptoms. Depression can have a significant impact on physical health. Individuals may experience fatigue, changes in appetite, or sleep disturbances. Cognitive symptoms. Depression can impair cognitive function, leading to problems with concentration, memory, and decision-making. Thoughts of death or suicide that they are common in severe cases. It is important to recognize these symptoms early, as timely intervention can prevent depression from worsening. 3. Types of depression. There are various forms of depression, each with distinct characteristics and severity. Understanding the type of depression an individual is experiencing is crucial for determining the most appropriate treatment. Major depressive disorder. This is the most common type of depression, categorized by a combination of emotional, cognitive, and physical symptoms. The severity of symptoms often interferes with daily activities and relationships. Persistent Depressive disorder. This type of depression is less intense but lasts for at least 2 years. People with PDD often experience a low mood and diminished interest in activities, but the symptoms may not be as severe as those of MDD. Bipolar disorder. Bipolar disorder involves alternating periods of depression and mania, extremely elevated moods. Depressive episodes can resemble major depressive disorder. Seasonal affective disorder. SAD is a form of depression that occurs during specific seasons, most commonly during the winter months when sunlight is limited. It is believed to be linked to changes in daylight and can be treated with light therapy. Postpartum depression. This type of depression affects women after childbirth and includes symptoms of extreme sadness, fatigue, and difficulty bonding with the body. Each type of depression requires specific treatment. Number 4. Causes of depression. Depression can be caused by a variety of factors, ranging from biological and psychological to environmental influences. While there is no single cause, a combination of factors often contributes to the development of depression. Genetic factors. Family history plays a significant role in the development of depression. Individuals with a family member who has experienced depression are more likely to develop it themselves. Biological changes. Depression is often linked to changes in brain chemistry, particularly in the levels of neurotransmitters such as serotonin, dopamine. These chemicals affect mood regulation, and an imbalance can lead to depression. Hormonal imbalances. Hormonal changes during pregnancy, childbirth, menopause, or due to thyroid problems can trigger depressive episodes. Postpartum depression is a common example of depression linked to hormonal changes, psychological and environmental factors. Stressful life events, such as the loss of a loved one, relationship problems, or financial difficulties, can trigger depression. Additionally, childhood trauma, abuse, or neglect can predispose individuals to depression in adulthood. Understanding the causes of depression helps in developing more effective prevention and treatment strategies. Number 5. The impact of depression on daily life. Depression can significantly affect various aspects of an individual's life, including work, relationships, and overall well-being. The following are some of the common ways depression impacts daily life. Work and productivity. Depression can severely impair an individual's ability to concentrate, make decisions, and perform tasks at work or school. People with depression may miss work or have a reduced ability to meet deadlines and expectations. Relationships. Depression often leads to social withdrawal, making it challenging to maintain close relationships. People with depression may isolate themselves from family and friends, which can cause strain on relationships. Self-care. Depression can lead to a lack of interest in personal hygiene, eating habits, and exercise. As a result, individuals may experience physical health problems, such as weight changes or fatigue. Quality of life. The overall quality of life is often destroyed when someone is suffering from depression. Hobbies, interests, and activities that once brought joy may no longer provide satisfaction, leading to feelings of emptiness and frustration. The impact of depression on daily life can be profound, making it crucial to seek treatment and support. Number 6. The relationship between depression and anxiety. Depression and anxiety often occur together. Also, two conditions can exacerbate each other. While depression is categorized by persistent sadness and lack of motivation, anxiety involves exercise, worry, restlessness, and fear. Co-occurrence. Studies show that significant percentage of people with depression are experiencing anxiety disorders. The combination of these two conditions can lead to hygienic stress and make it more difficult to cope with daily challenges. Symptoms overlap. Both depression and anxiety share some common symptoms such as difficulty concentrating, sleep disturbances, and irritability. This overlap can make it difficult to distinguish between the two conditions without thorough assessment. Also, treatment considerations. Treating both depression and anxiety simultaneously often requires a tailored approach, including therapy, medication, and lifestyle changes. Also, addressing both conditions can improve overall mental health and quality of life. Recognizing the relationship between depression and anxiety is important for effective diagnosis and treatment. Number 7. How depression affects physical health. Depression is not just a mental health issue. It can have a significant impact on physical health as well. The mind and body are closely interconnected, and the effect of depression can manifest physically. Fatigue. People with depression often experience extreme fatigue and low energy level, which can make it difficult to carry out daily tasks or responsibilities. Sleep problems. Depression commonly causes sleep disturbances such as insomnia or hypersomnia. Both conditions can contribute to fatigue and worsen depressive symptoms. Appetite changes. Depression can cause significant changes in appetite. Some individuals may overeat to cope with their emotions, leading to weight gain, while others may lose interest in food, resulting in weight loss, pain, and aches. Depression can cause unexplained physical pain, such as headaches, back pain, and muscle aches. These physical symptoms can be debilitating and further exacerbate feelings. Addressing the physical symptoms of depression is an important aspect of treatment and recovery. Diagnosis of depression. Diagnosing depression involves a comprehensive evaluation by a health care provider. This process includes a detailed assessment of the individual's symptoms, medical history, and may underlying health conditions. Clinical interviews. A mental health professional will conduct interviews to understand the individual's emotional and behavioral patterns, including how long symptoms have been present and how they impact daily life. Physical examination. A physical exam may be conducted to rule out other medical conditions that could contribute to symptoms, such as thyroid issues or vitamin lacks. Also, screening tools. Depression screening tools such as questionnaires and surveys may be used to assess the severity of symptoms and help with the diagnosis. Accurate diagnosis is essential for providing the most effective treatment plan. Treatment options of depression. Treatment for depression typically involves a combination of therapies, medications, and lifestyle changes. The specific treatment approach will vary depending on the severity of the depression and the individual's needs. Psychotherapy, cognitive behavioral therapy, interpersonal therapy, and other forms of therapy are effective for helping individuals address negative thought patterns, improve emotional regulation, and build coping skills. Medication. Antidepressants such as selective serotonin reuptake inhibitors and serotonin norepinephrine Reuptake inhibitors are commonly prescribed to help regulate brain chemicals that affect mood. Lifestyle changes, exercise, a healthy diet, and sufficient sleep can support overall mental and physical health. Additionally, mindfulness practices and stress reduction techniques can help improve mood and resilience. An individualized treatment plan that combines different approaches can provide the best results. Number 10. The role of support systems in depression recovery. A strong support system is essential for those dealing with depression. Having a network of friends, family, and mental health professionals can help individuals feel less isolated and provide encouragement during difficult times. Family and friends. Loved ones can offer emotional support, listen without judgment, and provide practical help such as assisting with daily tasks. Support groups. Joining support groups, either in person or online, can provide a sense of community and help individuals realize they are not alone in their struggles. Mental health professionals. Regular therapy sessions with a licensed mental health professional can help individuals navigate their emotions, build coping skills, and track progress over time. Support systems play a critical role in both recovery and prevention. Number 11. Self-care and coping strategies for depression. In addition to professional treatment, self-care can significantly contribute to managing depression. Developing healthy coping strategies is important for individuals to improve their emotional well-being and overall quality of life. Exercise. Physical activity releases endorphins, which are natural mood enhancers. Also, regular exercise can also improve energy levels and help combat fatigue. Mindfulness meditation. Mindfulness techniques such as deep breathing, meditations, and yoga can help individuals stay grounded and reduce stress. Healthy eating. A balanced diet with proper nutrition can improve overall mood and energy levels. Omega-3 fatty acids found in fish and nuts have been shown to have mood-boosting properties. Sleep hygiene. Establishing a regular sleep routine and creating a resultful environment can help address the sleep disturbances often associated with depression. Practicing self-care is essential for improving mental health and supporting the treatment process. Number 12. Preventing depression relapse. For individuals who have recovered from depression, the risk of relapse remains a concern. However, there are strategies that can help prevent depression from returning. Ongoing therapy. Continuing therapy after the initial treatment phase can help individuals maintain process and stay on top of any emerging symptoms. Medication maintenance. Some individuals may need to continue taking antidepressant medication for an extended period to prevent relapse. This should be done under the guidance of a healthcare. Lifestyle adjustments. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and strong social connections, can help individuals cope with stress and prevent future depressive episodes. Number 13. Conclusion. Depression is a complex mental health disorder that requires attention and core understanding. Its symptoms, causes, and treatment options is crucial for effective intervention and recovery, with, of course, appropriate treatment, support systems, and self-care practices. Individuals can manage depression and lead fulfilling lives. If you or someone you know is struggling with depression, seeking help from a mental health professional is an important first step toward recovery.